Yes.
Okay, hello, I'm Dr. Herman, and here's a patient of mine. This is
Joe
Mr.
Embris.
Joe Embris, and he lives down here in South Florida. And Mr. Embris had come to my office because he had terrible neuropathy.
Neuropathy in the leg, primarily caused by diabetes.
Yeah.
Okay. Bad circulation problems, and also some mental retardation.
No retardation, but dementia. You felt losing memory, and short-term and even long-term memories and loss. He's just being a character with it, but now he can smile because before it was much worse. But it still has a long way to go. But with the foot, it was more numbness. It was tingling. It was burning. What would you describe the foot?
It was numb, and when I walked, okay, my calves would cramp up on me. I could only walk so many yards, and then I'd have to stop and wait a few minutes, and that's been gradually getting longer and longer before I have to stop before it cramps up on me totally. There is improvement. Let's put it that way.
Yeah, and we're looking at this within just a few months of what we discovered. And what I told him on day one was there's some circulation problem, there's some heart condition, and he said, no, there isn't.
Everything's fine. Nobody's picked it up.
Because 2 years prior, when he had a breathing difficulty, he went to the hospital, they ran stress tests, they did an EKG, they gave him a green light, there's no blood pressure medication.
Correct.
You have no heart condition, they told him in the hospital, no cholesterol medication.
No.
And so when I did the evaluation, I sent him out for a CT scan, and here's the secret for peripheral arterial disease and heart disease and bypasses. Is that his CT scan that I ran on him showed a severely elevated calcification problem within the arterial system. And we've been, and that score for him, which I'm going to put pictures up with his permission now, put pictures up of the initial and the follow-up CT scan studies that we've done. But that first CT scan, when you look at the level of calcification, of severity, anything above 400 or 450 is severe. His score was 1,835. That is incredibly severe. That's like just incredible how severe that was. And he really wanted to grab the bull by the horns. And unfortunately, after the first 2 weeks, he had to get open heart surgery, and they did a quadruple bypass.
Quadruple bypass, yes.
And after that, we still did some follow-ups with him for the next 6 weeks and every 6 weeks after. And the score dropped from 1835 to 1740 in 6 weeks, down to 1669 in the next 6 weeks. And now we just ran the most recent one.
It's 13 and something.
1375. It's over 500 points lower within a period of 3 months, 4 months?
Well, we started the first one. It was at the end of April.
End of April, and here we are in the first week in August. So we're looking at maybe 3.5 months or so. We're already over 500 points lower with his calcification score, and it's going to keep getting lower, and we're going to follow up soon. Thank you for your time, and you can reverse your heart disease and your peripheral arterial disease, and we're doing it.
I'll vouch for that.